Circumcision. This is the last section of the night, and there is some graphic images in here, of course, because circumcision is graphic. It's a big topic. So this right here is a global map of male circumcision prevalence at country level. Okay, there's only a few. I guess there's nobody living in Greenland, Antarctica. I know my geography. And that's Greenland, and there's no data there because I don't know if there's people there. There's all these other countries, the blue countries. There's 0 to 20% of people are circumcised. Okay, so you can see the vast majority of the lesser known world, you know, they just don't do it. It's only in the industrialized nations, and mainly the hot seat is Africa and the Middle East, which is predominantly because of the high Muslim populations, because it is mandatory in Islam that you are circumcised. And I didn't look into all that on how, but we're gonna talk about that. So you can see of the non-Islamic world, there's only a few that actually still have a somewhat majority of people circumcised, although in the United States it's down to 65%. It's actually almost even. All right, so reasons to circumcise. The 3 reasons that you typically see are disease reduction, religious, and cultural. So those are the 3 things that I'm going to cover in detail. We're going to talk about female circumcision first, though, right? Because we need to. Okay, you guys do know that female. I talked to somebody tonight. They had no idea female circumcision actually happened. And so, yes, this actually happens. This is a map of Africa, and you can see in Egypt, in Guinea, and Somalia, and some of these other little countries, almost 100%, 90 to 100% of women are circumcised. It's a tremendous number. So there's 3 types of female circumcision. I'm not going to show you pictures. You guys can use your imaginations here. Number 1 is removal of the prepuce and part or all of the clitoris. Okay, so you know that's just type 1. Type 2, removal of that and part or all of the labia minora. If you guys don't know what the anatomy is and what this all means, you can look it up on Google later. You can look at the slides and go and yeah, you'll get it after that. Type 3, just think everything. Okay? They remove part or all of the labia minora with the labia majora sewn together, covering the urethra and vagina, leaving only a small hole about the size of a straw for passage of urine and menstrual fluids. So in other words, at this point, sexual intercourse is impossible. You cannot have sexual relations at that point. It's not going to happen. So what you find, though, is there are no medical benefits. 0. They have not shown any medical benefits. Other than, I take that back. I bet you, if they study this, would you guys not see that type 3 would decrease the risk of HIV/AIDS? I mean, we might need to study this and promote it in the United States. Would you guys like to sign up? Okay? I love the women. They're like, no way, but you guys, it's okay for you. When we start talking about the females, they're like, oh my God. This ain't your parts we're talking about. No ethical justification. No ethical justification. Guys, there is a worldwide outrage over this happening in Africa. There are tons of groups out there that are focused and doing rallies and marches to stop circumcision of females in Africa. This is happening. Okay? So there's no ethical justification. So there only leaves one thing. Only religious choice can justify. Can it justify? All of us in here would have to argue, yes. If that is your religion and you choose to do that, I can't argue with you. You have the right to do that to your own body. Make sense? To your own body. Your parents don't have the right to make that choice for you. You see, we never think about these questions when it comes to females. We just then think about, this is where it comes in again. What do we know? Why do we know it? And who sold it to us? You take it out of context, and all of a sudden your frame of mind changes. You think about it differently because you haven't been confronted from this angle before. All right. So the history of male circumcision. This is just fascinating. The oldest evidence that you can come across comes from the ancient Egypt of 2400 BC. The Book of the Dead references the sun god Ra cutting himself and the blood creating two minor deities from that. That's the first historical reference we can find of circumcision. In Genesis, God told Abraham to circumcise for a covenant. Absolutely did. Genesis 17, 10 through 14. You can look it up. Okay? We're going to cover that one in a second. Males in Africa were circumcised as a rite of passage and to become members of the warrior class. But it was not done as kids. It was done as, and in a lot of parts, in many places in the world, it's still done to acknowledging men, kind of like men join the military here. You know, there they choose to do that, and they do it wide awake, and it's actually one of these things where they do it with no anesthetic, and their rite of passage is doing it with a straight face. Try doing that, guys. No way. So this is actually ancient Egyptian hieroglyph, one of the earliest ones of a man fondling another man's penis. You're supposed to laugh about that. Okay. History of male circumcision further. In the Greco-Roman world, predominantly only Jews were circumcised. This is where it gets really interesting. Only Jews were circumcised. Okay? Jews would go to measures to lengthen their foreskin to compete in athletic events, such as the Olympics. Do you know that the Olympics used to only be men? You could only compete if you were a man. In fact, you could only spectate if you were a man. Why? Because they weren't allowed to wear performance-enhancing gear like they are today. They did it in the nude. So you got a bunch of nude dudes running around competing against each other. Now you know. Imagine wrestling. That had to be awful. And that's what's really weird is that was one of the first sports. So they would go to extreme measures. They would actually make these devices. They have a name to them. That's basically what we would think of as a fishing weight, where they would hang it from their foreskins because it's a known principle that if you stretch skin over time, it will lengthen. If you've ever seen anybody that's lost a lot of weight, you'll see that that is true. Okay? Skin will actually stretch and lengthen over time. So the Jewish men, young men, would be able to fake that they were actually Greek or Roman. And then they could compete. Well, we can't have that. We're going to change that. So as a result, Jewish leaders added a more radical procedure around 140 AD called pariah, in which the entire foreskin was pulled back and removed. Because if we cut it all off, then you can't hide that you're Jewish. This is probably one of the best examples in Scripture of the difference between commandment keeping and legalism. They took something that was a commandment and they made it their own. They extrapolated on it and made it something that was beyond the imagination of those who wrote the scriptural text. Okay? Some took it even further to say that because in Scripture, I mean, it says that it's supposed to have a drop of blood, so in order to make sure that the drop of blood came out, we're going to put our lips to their penis and we're going to suck the blood out of the penis. And that was spreading venereal disease amongst Jewish boys. So for the most part, wisely, that has been practically stopped, except you just saw a while back, this was actually in the media because a little boy got herpes because they found out that a Jewish priest of one particular sect was still doing this. Okay? This is true stuff. If you look at the statue of David, you would assume that he is actually uncircumcised. But see, Michelangelo was brilliant, and he knew what circumcision of Hebrews actually was. And so while he looks like he's circumcised, while he's uncircumcised, he is actually circumcised. He has the mark, but it is a Jewish a true Jewish circumcision. It's not what we do as circumcision today. Okay? It gets worse. What? Tony the Tiger? Don't read ahead. Encyclopedia Britannica, 1876, discusses circumcision as merely a religious rite among Jews, Muslims, the ancient Egyptians, and other tribal peoples. However, in the 1890s, circumcision became popular by allopaths, medical doctors, to prevent masturbation, as well as many other ridiculous devices and measures. They would actually use, they would instruct you to wrap your child's penis in plaster of Paris. They wore garter belts. They wore steel cages. They wrapped their penises in leather straps. They would put them in metal casings. I mean, they would do all these things to prevent childhood masturbation. But the most effective, of course, is chopping it off. Right? That's the most effective. So, one major advocate was, in fact, Dr. John Harvey Kellogg, who advocated the cure for masturbation, I tell you, is eating cornflakes and circumcision. This is true. I can't believe you guys aren't laughing. Yes. All right, then... So all of this stuff, it came out of the mass hysteria. This was a big deal in the 1890s. Basically because of religious interference, religious interjection. The religious mobs and the churches were really behind this, in this mass hysteria about masturbation, that it was demons and evil spirits and everything else. So the whole nation was in an uproar about this. This was a big deal in that time frame. Then in 1929, it wasn't until 1929 that medical institution had changed the definition after widespread adoption from above to primarily medical reasons of cleanliness and preventative. So for 40 years, it was really about the hysteria. But as they started losing ground on that and people starting to question the model, then they shifted focus and they started talking about cleanliness and started coming up with ideas, on how it decreases diseases and it decreases infections and bladder infections, and it's all about prevention and making sure that people don't get these things. That's where the shift focused to. But it wasn't until 1929. Before that, it was all about masturbation. That's it. Okay? So, disease reduction. Royal Australian College of Physicians says this is Australia's official policy. After reviewing the currently available evidence, the RACP believes that the frequency of disease modifiable by circumcision, the level of protection offered by circumcision, and the complication rates of circumcision do not warrant routine infant circumcision in Australia and New Zealand, 2010. Their national healthcare system will no longer pay for it. It is a purely elective procedure. Their circumcision rates dropped. They're through the floor. They don't do it anymore. The Canadian Pediatric Society. Circumcision of newborns should not be routinely performed, i.e. in the absence of medical indication. This is their current policy. They don't do it anymore. They have a social medicine system who doesn't pay for it. The British Association of Pediatric Surgeons, the Royal College of Nursing, the Royal College of Pediatrics and Child Health, the Royal College of Surgeons of England, and the Royal College of Anaesthetists came out with a joint statement in agreement between all of them that deemed routine circumcision without precise medical warrant the equivalent of malpractice. It should not be done. In the UK, they do not do routine circumcisions anymore. The American Academy of Pediatrics, in 2000, I don't know when this was done, it changed in 2012. The AAP, this was I think 2010 or 2009, somewhere in there. The AAP does not recommend routine, performed in the absence of medical indication, circumcision of the newborn. So it lined up with all the other institutions. All around the industrialized world, it lined up. This statement emphasized the need for well-informed consent of the parents, plural. Not just one parent. The idea is one parent could not choose to go and do the circumcision. Because they knew, generally speaking, who wanted to push for it. The dads. So the idea is both parents had to agree to this. But then in 2012, against the recommendation of almost every other developed nation standards, and I say almost simply because I do not know, I can't say all, but none of them that I could find had a challenging statement on this. They chose instead to protect doctors in an updated statement guarding it as elective and even recommended. If you look at our websites now, the American Medical Association and the American Academy of Pediatrics, they actually say that that the benefits earned justify the means, even though the rest of the developed world cannot find those benefits. So what's it really come down to? The Judeo-Christian reasons. The circumcision we perform today is not a biblical circumcision. If you think you're getting circumcised because the Bible tells you to, I found this out, you're wrong. Unless you're a Jew. We almost circumcised our 9-year-old. He's very happy we didn't. You know? Well, he'll be happier later, but he's at least happy now. When he saw me studying this stuff, and he's like, what? I mean, can you imagine the child's face when you tell him we cut penises? Like, I mean, he's like, he was freaked. According to both biblical account and the vast majority of biblical authorities, Gentile believers have no requirement to circumcise, especially infants. I went to links when the decision was ours that I actually went through a doctoral teacher that is a mentor of mine. He passed it on to a Jesus-believing Jewish rabbi in Israel, in Jerusalem, to ask him what our needs were. Did we need to do it? And this was his answer. He said, in writing, he said that as a Gentile believer, we had no necessity to circumcise. That the only reason we would do it is to choose to do it as an adult only to better identify with our Jewish brothers. That was it. So in other words, if you wanted to fit in with your Jewish brothers and basically claim that you're one with their community, you could do this as an outward sign to it. I just rather say, hey bro. Like, even if you have access to traditional Hebrew ritual circumcision, which most of us don't. I mean, in Mobile, Alabama, I really doubt that. It is therefore purely an elective procedure unless you are born Jew. If you're born Jew, I can't really tell you. I mean, it does make it very clear that Jews in the Bible are supposed to have that covenant. That's just part of their society, and there's a lot of reasons behind that. But we're not going to get into that because I don't know anybody in here that's Jewish. Okay, so the reason why I want to point all that stuff out is before we actually look at what this is. The foreskin, a true biblical milah circumcision, is just the very, very tip. What they would actually do is take a leather strap that had a little tiny hole in it, and they would put the penis up to the hole, and they would pull the foreskin just through that hole and nip the tip. They would just barely cut it off, and it might bleed a drop. And that was it. And what happens is that particular skin, it heals really, really quickly. In fact, it almost regenerates, which we'll get into. So it heals fast, and it only leaves a mark that most people would only identify if they were examining it closely. Which really, if you think about it, are only 3 people. You, your mother, your parents, and your spouse. Those are the only ones that really should ever see if you have the mark or not. The point is, it's not for the outside world. It's only for the community. That is a true biblical circumcision, is they just cut the very foreskin off. The false pariah circumcision, which they actually identify here as a mutilation, is what the Jewish authorities instituted, like we were talking about earlier, where they actually take the entire foreskin and they use a little bell and plastic cup and all that stuff now, and they stretch it all off, and then they cut it all the way around, exposing what is not supposed to be exposed, the glans penis. Okay? So this is what a true biblical Milah circumcision with foreskin removed would look like, which really does not look any different from that one. Okay? And then this one is the false Jewish pariah circumcision, which unfortunately most of us look like. So, and it's simply because, as I explained to my son the other night, my 9-year-old, he was asking, well, why do they do that? And I said, well, why do you think they do that? Why do you think that most people still do circumcisions today, even though the information is available? And he thought about it, and he thought about it, and he thought about it, and he didn't really know. And I said, the reason why people still circumcise, despite the information that's available, is because most people still circumcise despite the information available. That's the reason. It's because we just don't stop. We just continue to do the same thing over and over again, which is the definition of insanity. It's insanity. Okay? Cultural justification. This is the last one. The crowd. In 1999, neonatal circumcision rates in the U.S. have remained around 65% since 1979. While only 37% are in the West hardly circumcise at all. You go out to California, it just doesn't happen that much. But in the South, it's still 80%. Like everything, we're still slow in the South. Right? The circumcision market, here's where it gets interesting. The circumcision market is a multi-billion-dollar industry. It's being the most common surgical procedure done today. Did you know that? It's the most common surgical procedure done. The resale value of each baby's foreskin, according to the Examiner, March 19th, 2011, could be as much as $100,000. So understand this. Yeah, this is real. You're like, all of a sudden you're, yeah, you should be getting pissed right now. Because they charged you to have the surgery to cut your kid's penis off, giving you false information to do so. Then they turn around and they sell it to the drug companies to make facial creams for old ladies, to make burn bandages for burn victims, and to make skin grafts for people having other surgeries. And for pharmaceutical research, of course, because we need better drugs and we need the cure for cancer. And yeah. So they turn around and they sell it. So who do you expect is continuing the push for routine cutting? Why is it that every other country that has a social medicine system doesn't do it anymore, but the one that still profits from it is? You know, I mean, this just is not even an argument. You see that? It's just not even an argument. If it's religious, I can't tell you no. There's one more thing, though, just like Daddy. This is the most common reason that I hear. By far. I want to look like Daddy. Well, the kid doesn't say that. The kid says, screw Daddy. Right? Just like Daddy. The only justification remaining is not religious, medical, or cultural. It's a parent's choice to subject their baby to it. To be clear, as of today, you do have the legal right to do it. As of today, right now, you do have the legal right to choose that for your child. And nobody's gonna sue you. Nobody's gonna get on you. Nobody's gonna turn you into the HR. It's not gonna happen. You have a legal right to. Doesn't mean you have the ethical right, though. Doesn't mean you have any other right, but you do have a legal right. 2 questions I want to ask here that I hopefully will sum up this argument. Number 1, if you were not circumcised, would you elect to circumcise with your child to look alike? Would you choose to do it yourself? If you knew all the scientific, the anatomical, the physiological reasons and functions of the foreskin, no, you would not. You wouldn't. The second question, if you were missing a finger or a foot, would you find it reasonable to cut your child's off to look like you? Does that pretty well sum it up? Should that also be legal? You see, guys, the point here is, are you not still having a little bit of a mental struggle with that? Like, oh, come on. You're going to cut off your baby's finger? I mean, think about it. Is it really any different? Well, it doesn't change any fuck. Really? Were you ever uncircumcised? Do you have anything to compare it to? Do you have any friends that are uncircumcised? Have you talked to them about their sex life? These are things that we have not answered, and yet we're experts on it. But seriously, how is it any different from missing a finger? I mean, you can function with 4 fingers. I mean, I can try to... I mean, I feel equipped, right? I could still drink my drink. But you see, we're missing the big picture here. The big picture is it necessary? Do we need to do it? Is it worth continuing to promote? And is it worth doing it to our children and choosing it for them? You know what? If your child chooses to be Muslim or chooses to identify with his Jewish friends, let him do it. Let him do it. But if it's not in those terms, I'm just asking you, I'm not telling you, I'm not saying that I have the right to tell you, but I do have the right to educate you. So think about it. Do your reasoning, and guys, if you already, I know a lot of us have already done it. We've already done it to our kids. I had a conversation today with a patient who I haven't seen in about a week and a half because his wife had a baby. They had the baby early. They actually, they were planning on coming to this. They ended up having the baby early, and they didn't know that I was going to be covering this topic, and they had their little boy circumcised in the hospital right at birth. And I was talking to him about this today, and he's like, there's nothing I can do. And that's right, there's nothing legally you can do. There's nothing that you can do about it. But what can we do? We can still educate. We can still help other people. We can still make this information known so it doesn't continue to happen and it doesn't continue to just repeat over and over and over again with our kids, with our grandkids, with our kids, grandchildren. It doesn't have to continue so that somebody else can profit off of it. That's the whole point. Okay? So I know some of you are going to be like, oh man, mad at me, mad at the information, mad at the doctors, whatever. You see, I care, but I'm a pompous jerk, right? So I'd rather educate you and take the risk of getting people mad at me than just let the information continue because I don't want to hurt anybody's feelings. Make sense? Okay. So that is it for tonight. I know that one went a little bit longer, but I hope you guys see the reason why we had to go long on this. This is not a soft topic. This is not something that we can